20,000 doses of Russia's Sputnik V vaccine have arrived in Bolivia to be administered to frontline health personnel. The White House has announced that Donald Trump administration's policies on Cuba will be reviewed by the new U.S. government. The African Union announced this Thursday that it will procure 400 million additional doses of COVID-19 vaccines for its member countries. From the headquarters of teleSUR English in Havana, Cuba, this is From the South. I'm Gladys Quesada. On Thursday, Bolivia received the first batch of the Russian Sputnik V vaccine, which will be first administered to health sector workers in order to protect the lives of those in the front line on the battle against the coronavirus. The 20,000 doses of the Russian vaccine arrived from Moscow to Argentina before being transported to Bolivia's El Alto International Airport, where the shipment was officially received by President Luis Arce. This first batch of 20,000 doses of Sputnik V is part of the 5.2 million purchased by the government to vaccinate the population free of charge against COVID-19. Bolivian President Luis Arce offered statements regarding the arrival of the first batch of Sputnik V vaccine doses in order to start the country's mass immunization campaign.
We will gradually apply the vaccine to all the Bolivian people, so that once and for all, in this 2021 administration, we will say goodbye to the coronavirus. There is a contract signed, and we are always attentive to working and improving and providing the greatest amount and the necessary opportunities to secure vaccines for the Bolivian people.
And the third shipment of the Russian Sputnik V vaccine has arrived in Argentina from Moscow to continue the vaccination process in the country. The flight was carrying 220,000 doses of the vaccine against COVID-19. Government sources also inform of the arrival of some 20,000 doses destined for Bolivia as part of an act of solidarity. The Russian Direct Investment Fund informed that Argentina has a warranted supply of the vaccine, while warning that part of the agreed shipments could be delayed by 2 to 3 weeks due to improvements in the distribution strategy for the region. The government of Chile received the first shipment of almost 2 million doses of Chinese lab Sinovac vaccine against COVID-19. Speaking from the Arturo Merino Benitez International Airport, President Sebastián Piñera informed that the first shipment of almost 2 million doses will be complemented by another similar shipment that will arrive in the country on January 31st, with 1.92 million doses from China to help the country contain the spread of the virus. Authorities informed that the vaccination campaign will begin on February the 3rd, and the first stage will be directed at medical personnel and senior citizens. The Chilean government reiterated its confidence in the Sinovac vaccine after clinical trials show 100% efficacy. Hospitals are full and shops remain closed in the northern Brazilian city of Manaus as it continues to face a sharp increase in COVID-19 cases despite a lockdown.
I have my job here, but I protect myself, I get home, I get to my mother's house, I take off my clothes before I do anything, I take care of myself. But there are people who don't do that, who do not care. I think that for sure this new variant is going to hurt more people here in Manaus. I am afraid. I avoid leaving the house and I am only going out for essentials. If I do not have a necessity or I do not have anything to do, I do not go out.
In Colombia, the body of the 16th social leader murdered this year was found after being missing for 11 days. Fermiliano Meneses, who disappeared last Friday, January 15th, was subjected to attacks during his political activities in his home municipality. According to local media, Meneses was kidnapped by unidentified persons and taken to the village of El Plateado in the municipality of Argelia. His body was found on Wednesday, and authorities are yet to clarify the circumstances surrounding his murder. However, the governor of Cauca department has attributed the crime to members of the National Liberation Army, or ELN. In Ecuador, the armed forces announced that they have requested financial support to cover the expenses involved in the printing of the ballots and the preparation of the electoral logistics and to comply with the electoral schedule questioned by opposition candidates.
But there is a problem there, and the problem is financial. Why? Nevertheless, we have signed a work agreement of support from the armed forces to the National Electoral Council. The agreement was signed to obtain financial support. Obviously, the printing costs, the logistics of the armed forces to transport the kits to the polling stations and boards, vote receivers, resources are needed for that. We made an effort to reduce the necessary expenses to the minimum, because we are going to participate with what the armed forces organically has, and for what the armed forces alone cannot absorb, we have to resort to the logistics.
A few hundred journalists and opposition activists marched peacefully in Haiti's capital on Thursday to denounce police brutality and demand justice for the colleagues slain in recent years.
Already been victims of the PHTK regime in the last 10 years. We do not want these things to happen again. We do not want to return to the dictatorship. This government supports the police terrorists and terrorized journalists. I ask for solidarity to drive out the dictatorship in power.
And we'll go now to a short break. Follow us in Twitter at teleSUR English and Gladys teleSUR. Welcome back. White House Press Secretary James Psaki announced that the Donald Trump administration's policies on Cuba will be reviewed by the new government.
I ask one more on Cuba. Do you guys plan on walking back all of those restrictions that were put into place under the Trump administration after the Obama administration had opened things up with Cuba?
Well, our Cuba policy is governed by two principles. First, support for democracy and human rights. That will be at the core of our efforts. Second is Americans, especially Cuban Americans, are the best ambassadors for freedom in Cuba. So we'll review the Trump administration policies, as we are in a number of other areas of national security, with an eye to ensuring that our approach is aligned with that. But we will take our own path. I don't have anything to predict for you at this point in time.
And the U.S. President Joe Biden signed two executive orders this Thursday, including one scrapping a ban on U.S. funding for abortion counseling provided by the international organizations, and ordering a review of rules under Donald Trump's administration that block government-funded family planning clinics in the United States from referring women for abortions. Biden also signed an order extending health care access.
Today I'm about to sign two executive orders, and basically the best way to describe them, to undo the damage Trump has done. There's nothing new that we're doing here other than restoring the Affordable Care Act and restoring the Medicaid to the way it was before Trump became president, which by fiat he changed, made more inaccessible, more expensive, and more difficult for people to qualify for either of those two items, the Affordable Care Act or Medicaid.
In 2020, the United States saw its biggest fall in GDP since the end of the Second World War due to the COVID-19 crisis. According to data from the U.S. Federal Reserve, GDP shrank by 3.5% by the end of 2020. Exports fell by 13% last year, and personal consumption fell by 3.9%. This is the first time annual growth has contracted since 2009, when the economy shrank by 2.5%. With the virus still out of control in much of the country, economists expect economic growth to remain negative in the first quarter of this year, before an eventual recovery by the summer, should the stimulus promised by the Biden administration and the mass vaccination against COVID-19 take effect. And this month's coronavirus surge in Portugal has stretched medical services to breaking point. According to population size, Portugal has the worst hit country in the world for more than a week in terms of new daily COVID-19 cases and fatalities, as shown in data compiled by Johns Hopkins University. The country is now facing an alarming problem. As soon as new hospitals beds become available, they are quickly filled and more are needed. And while extra beds and new wards are relatively quick to produce, the necessary trained medical staff aren't. Experts predict the surge will peak in mid-February, raising the possibility of a total collapse of the health system. The Portuguese government is turning to other European Union countries for help. Germany sent a team of 2 doctors and a medevac specialist to Lisbon on a reconnaissance mission this Thursday.
We need to expand, to create more room. We need to acquire equipment and create conditions to have physically and structurally more patients in intensive care. That is on one side. The human resources factor is finite, not endless. And that is the most critical situation, and where naturally we are worried that it can become a situation of complete collapse.
The recently appointed Spanish Health Minister Carolina Darias stressed that the country is still aiming to vaccinate 70% of its population by the summer, despite a shortage of jobs causing authorities in the Madrid region to suspend new vaccinations for at least 2 weeks.
Commitment that 70% of the population will be vaccinated by the summer. This is the objective put forward by this government and shared by all the autonomous communities and the autonomous cities. We knew that in the first months of this year, especially the first quarter, the arrival of vaccines was going to be limited. We're talking about a scarce public good, and that is why we've established criteria for prioritizing groups.
And just a few days before the European Medicines Agency approves the 3rd vaccine for use in the European Union, pharmaceutical company AstraZeneca has announced production delays that compromise the European vaccination schedule. We have more in the following report.
Doses delayed. That's the delay AstraZeneca has announced to its first quarter delivery agreement with Europe. And it could increase further. The European Union is wary of the move being made by the drug maker, pointed out that some of the European doses could have been sold to non-European countries such as Israel or the United Kingdom, which could pay higher prices for each dose.
This new schedule is not acceptable to Europeans. The European Union wants to know exactly how many doses AstraZeneca has produced so far and whether they've been sold, and if so, to whom.
The pharmaceutical company claims that the problem lies in European production plants, which are producing less than expected. After 3 meetings, the European Commission announced it appreciates AstraZeneca's constructive dialogue, but says there is a lack of clarity in the plant schedule. The blog also has notes that Europe has invested 336 million euros on public funds in its vaccine, although this has not yet been 100% paid.
The logic of these agreements was as valid then as it is now. We provide a de-risking investment up front in order to get a binding commitment from the company to pre-produce even before obtaining authorization.
Europe is demanding that the pharmaceutical company supply part of the doses manufactured in the United Kingdom to comply with the agreement, but AstraZeneca is refusing for the moment. The vaccine backlog is complicating the European Union's plan and the vaccination schedule in countries like Spain. Madrid has already announced that it's suspending the supply of new first doses in order to focus on supplying the second dose due to the shortfall.
It is impossible to reach the target set by the Spanish government of 70% of the population vaccinated by mid-June with the current vaccine delivery rates. This is absolutely impossible, unfeasible. In the Community of Madrid, it would mean that more than 9 million vaccine doses would have to arrive by that date.
So far, more than 1.2 million people have received at least a first dose of the vaccine in Spain. Despite the delays, the government assures that the targets for June can be met because sufficient doses are expected to arrive from both Pfizer and Moderna.
Adriana Cardoso y Edu Marín, teleSUR, Madrid.
And we have more news coming up after a final short break, so stay with us.
teleSUR English presents a weekly program to discuss the political, economic and social issues affecting the Caribbean community. We'll challenge stereotypes and unpack the diversity of the region through the analysis of unique cultures, religions and art. We Caribbean. Wednesdays. Only on teleSUR.
Welcome back to From the South. The African Union announced this Thursday that it will procure 400 million additional doses of COVID-19 vaccines for its member countries. The figure is in addition to the 270 million doses already secured previously by the African Union for mass immunization against COVID-19 across the continent. At the same time, additional doses are expected through the COVAX initiative created by the World Health Organization. It is estimated that the continent will need at least 1.5 billion doses to immunize 60% of its citizens. The director of Senegal's Institute for Health Research, Epidemiological Surveillance and Training confirmed that the country has recorded its first case of the more contagious coronavirus strain that initially emerged in the United Kingdom. According to Imperial College London, the British coronavirus variant likely emerged in southeastern England in September. The World Health Organization says it has already spread to more than 60 countries worldwide.
Epidemiological surveillance and training, in collaboration with its partners at the MRC Gambia unit of the London School in Banjul, have sequenced samples from the second wave of Senegal using whole genome sequencing and genotyped them using the next generation sequencing method. We hereby inform you that we have confirmed the presence of a British variant, SARS-CoV-2, in the samples of the second series.
And Mozambique's National Institute for Disaster Risk Management and Reduction has warned that more than 30,000 people could be affected by flooding in the next 2 days in the southern province of Gaza. The relief agency has attributed the flooding to the overflowing of 2 rivers due to the heavy rains caused by tropical cyclone Eloise. The agency warned that those living in the districts of Sai and Limpopo should evacuate the area for their own safety. Tropical cyclone Eloise, which hit central Mozambique last weekend, displaced thousands of people, destroying or damaging thousands of homes in an area battered by 2 deadly cyclones in 2019. UN Secretary General Antonio Guterres stressed on Thursday that the COVID-19 virus has set off a global crisis that is still unfolding. Guterres was speaking in New York to outline UN priorities during the pandemic. He also noted that this must be the year when we put our world back on track towards peace, stability and opportunity for all, because it is clear that we have lost our way. The UN chief called for an increase in vaccine production and warned that a global immunity gap puts everyone at risk. Guterres said his message for 2021 is one of hope and determination, as he believes it's possible to put the world back on the right track, and we must all do everything we can to make that happen. And farmers at major protest sites on the outskirts of India's capital were defiant on Friday as authorities called for an end to their months-long sit-in against agricultural reforms. Thousands of farmers, many on tractors, marched through New Delhi on Republic Day on Tuesday, where clashes with security forces left one person dead and at least 400 injured. The government blamed the protesters for the violence, and police increased their numbers outside the camps of the outskirts of the capital on Thursday, where tens of thousands of protesters have been camping since late November as they call for the new laws to be repealed. Authorities in Uttar Pradesh state, which neighbors Delhi, call for one camp in particular, the Ghazipur camp, to be cleared. But the farmers say they will not budge. Meanwhile, police sealed the roads into Delhi beside the main protest camp at the Sindhu border crossing, where tensions were running high. Among the union leaders who continue to protest in Rakesh Tikait, leader of the Brahminjats Kisan Union, who started a hunger strike at the Ghazipur border. Tikait has revived the union's mobilizations in the east of the country, despite the splits in the movement and the government's change of attitude in dealing with the farmers' demands. The Indian Executive Court ordered the dissolution of the protests, stating that the police will be free to evict protesters camping out in the streets. And the Indian Prime Minister Narendra Modi says more locally made coronavirus vaccines will be supplied to other countries as he hails the vast nation's fight against the infectious disease as successful.
Where 18% of the world's population lives, we averted a major tragedy by effectively controlling the coronavirus. We saved mankind from a big disaster by saving our citizens from the pandemic. In just 12 days, India has vaccinated more than 2.3 million healthcare workers. In the coming months, we will achieve our target of vaccinating 300 million elderly people and people with comorbidities.
And we have come to the end of this news brief. But remember, you can find this and many other stories on our website at telesurenglish.net. And also, if you feel so inclined, join us on social media, Facebook, Twitter, Instagram, and Telegram. For Telesur English, I'm Gladys Quesada. Thank you for watching.